Welcome to NOFAS Now. Policy and legislative issues are front and center as summer approaches, and NOFAS has some exciting recent and upcoming events to report on.
We'll tell you about a new way to follow the activities of the Centers for Disease Control and Prevention, or the CDC, and introduce you to a leader on FASD and an inspirational woman.
Up first, since our last program, Senators Tim Johnson and Lisa Murkowski have introduced S-2262, the Advancing FASD Research, Prevention, and Services Act that would reauthorize the federal response to FASD. When it comes to FASD appropriations, federal spending for the next fiscal year, there are concerns. The President's budget proposes changes that would dramatically cut future funding for the FASD Center for Excellence and make it more difficult for Congress to dedicate funding for FASD at the Centers for Disease Control and Prevention. NOFAS is also watching as the National Institutes of Health, NIH, continues to work on a plan that would create a new institute on addictions and, among other changes, eliminate the National Institute on Alcohol Abuse and Alcoholism, a move likely to dramatically marginalize FASD and other non-addiction alcohol research. Lastly, on the policy agenda, the American Bar Association will take up an FASD resolution at their meeting in August that would further recognition of the issue in the legal arena. Now, beginning this month, NOFAS will post action alerts on nofas.org with more details on each of these developments so you can weigh in.
On June 20th, NOFAS holds its annual awards benefit on Capitol Hill, hosted by Tom and Linda Daschle and Senators Johnson and Murkowski. Dr. Jean Hoyme, Chief Academic Officer at Sanford Health in Sioux Falls, South Dakota, is among the honorees. Nearly 30 NOFAS affiliates will be in town that same week to participate in our affiliate summit. June is a busy month for NOFAS. I'll be presenting with Dr. Tina Chambers at the Organization of Teratology Information Specialists annual meeting here in Baltimore, Maryland. The RSA, or Research Society on Alcoholism, FASD study group, is also meeting this month in San Francisco. Then I'm off to Seattle, Washington to participate in an exciting event, the Better Me, Better Mom Hope for Women in Recovery Summit. This is an all-day conference that's a collaboration between NOFAS and PCAP, the Parent-Child Assistance Program, that's directed by Dr. Therese Grant. We are really excited to be working so closely with this terrific program. Earlier this spring, NOFAS held Smart Moms, Healthy Babies Fashion Show Benefit featuring maternity clothes from Destination Maternity and activewear by Lululemon. This innovative event was the brainchild of NOFAS board chair Kate Boyce. She worked tirelessly along with a dedicated volunteer planning committee. Shaista and Ray Mahmood hosted the event at their beautiful Mount Vernon, Virginia home. The fashion show was emceed by Eun Yang, a popular television news anchor here in Washington, D.C. It was a fun afternoon and an enormous success.
For 20 years, the CDC has advanced the field through its work and leadership. The agency has partnered with many universities and organizations, including NOFAS, to understand the problem, fulfill the promise of prevention, and develop resources for children and adults with FASD.
On upcoming programs, NOFAS will feature interviews with FASD experts from the CDC Regional Training Centers, known as RTCs, and from Project Choices sites. The RTCs focus on training, and the Choices sites focus on alcohol screening. You can learn more about these programs by downloading their new app. Just search for FASD at the App Store. It's a really convenient tool. At your fingertips, you can access data, research, alcohol consumption rates, and resources.
In June, watch the NOFAS Weekly Roundup or YouTube channel for interesting interviews with Jerome Romero and Jasmine, a young woman living with FASD. Romero is the director of the New Mexico statewide FAS Prevention Program and the chair of the National Association of FASD State Coordinators. Jasmine is a member of the FASD Center for Excellence expert panel and a founding member of SAFA, the Self Advocates with FASD Action Network. Here's a preview.
My favorite program that I developed is a FAS, Fetal Alcohol Syndrome Peer Education Program. I work with teenage moms that have already had a baby or they're going to have a baby and they're parenting their kids. And I said I need little soldiers to go out there and spread my fetal alcohol syndrome message. Originally that's what it was. I'm going to educate these young men, young women, mostly young women, on fetal alcohol syndrome because, you know, they're the ones that could have potential future children with fetal alcohol syndrome if they continue to use alcohol. First time I did a presentation, I could see like 3 or 4 teary eyes in the classroom, and I knew that those young ladies had drank while they were pregnant. They stopped once they found out they were pregnant, but by that time, you know, they thought that they could have damaged the baby. And the reason I do this is I don't want moms to feel bad that they might have caused damage to their baby. If I can eliminate this birth defect, if we can prevent it, we can wipe out a birth defect, and that's kind of what I want to do. But my peer educators are the best. And I even had a girl once that named her baby after me because I guess the presentation, the workshop that I did with her made such an impact.
I got an early diagnosis at the age of 3, which was really important because then I got early intervention involved. I got a lot of speech therapy, occupational therapy. Really helped me to just get a grasp on life, really. Working in a deli is pretty much one of the hardest things I've ever done because you have a lot of tasks and they're not written down in front of you. I can only work at night because that way all the stuff that's supposed to be put out, because in a deli you also put out cheese and salads, pre-baked pizzas and all this other stuff. All that's already done. So all I have to do is focus on a couple things. And I mean, it's really hard. I had to find a job that would accommodate me like that. But before I worked at Wendy's, I had to do everything. It was just really overwhelming. And you had to work with money. Now I don't have to work with money. I could just give people their meat and it's just no problem. I wish there were more accommodations, to be honest with you. That's kind of why I have the SAFA network, to be honest with you, because we are actually discussing that in one of our sessions, is how to keep a job and what to let our employer know about our needs, because they aren't educated. They don't even really know about fetal alcohol spectrum disorders.
The NOFAS Georgetown University Medical School class on FASD just concluded. We had an outstanding class, and this year the students' project was to do doctor-patient role-playing on screening and brief intervention in a variety of clinical settings. With the talents of our own Andy Catcher, we got some great video that will soon be featured on nofas.org. Thanks also to Dr. Mike Ybarra, who co-facilitated the class with me this year. This was our 19th year of teaching the selective.
All right, Elizabeth, so since you're sexually active and not consistently using protection, there is a chance that you could get pregnant at some point, so I think it might be a good idea for us to schedule an appointment with your OBGYN.
I hate going to the OBGYN.
Well, I think it would be beneficial for you to go and see your OB. She or he could probably provide you with an additional form of protection, because we wouldn't want you to be in a situation where you did get pregnant, because with your current drinking patterns, not only is your health at risk, but you would also put the health of your baby at risk, and that could pose a lot of problems for both you and your baby down the line.
Okay.
Does that sound okay?
Yeah, I could do that.
All right.
Well, you can make sure not to miss the video with the Georgetown students and other news and features by signing up for the Roundup on our website. And we want to hear from you, so join the discussion on the NOFAS Facebook page. And lastly, watch for the launch of the new NOFAS website with even more information and more resources. And don't forget to join us again next time for another edition of NOFAS Now.